Birth control is a term that encompasses a variety of methods designed to prevent pregnancy. The most common forms, especially in the context of hormonal balance, are hormonal contraceptives. These include birth control pills, patches, injections, implants, and intrauterine devices, IUDs, that release hormones. Understanding how birth control affects hormonal balance first requires some background on how the menstrual cycle works and the role hormones play in the body. The menstrual cycle is regulated primarily by the interplay of several hormones: estrogen, progesterone, luteinizing hormone, LH, and follicle-stimulating hormone, FSH. At the beginning of the cycle, FSH stimulates the growth of follicles in the ovaries. One of these follicles will mature into an egg. As the follicle develops, it produces estrogen, which helps build up the lining of the uterus in preparation for a potential pregnancy. A surge in LH triggers ovulation, the release of the egg from the ovary. After ovulation, the ruptured follicle becomes the corpus luteum, which produces progesterone. Progesterone stabilizes the uterine lining and makes it receptive to a fertilized egg. If pregnancy doesn't occur, levels of estrogen and progesterone fall, leading to the shedding of the uterine lining, what is experienced as a period. Hormonal birth control methods work by disrupting this natural hormonal rhythm. For example, combination birth control pills contain synthetic versions of estrogen and progestin, a synthetic form of progesterone. These hormones are delivered in consistent, regulated doses, which prevents the natural fluctuations that would otherwise trigger ovulation. By maintaining stable hormone levels, birth control pills essentially override the body's normal hormonal cues. The steady presence of synthetic hormones suppresses the body's own production of FSH and LH, preventing the ovary from releasing an egg. This suppression of ovulation is the primary way birth control pills prevent pregnancy, but the hormones also have secondary effects. For instance, they thicken the cervical mucus, making it more difficult for sperm to reach the egg. They also thin the lining of the uterus, making it less likely for a fertilized egg to implant. Progestin-only methods, such as the mini pill, hormonal IUDs, injections, and implants, primarily rely on the action of progestin to prevent pregnancy. These methods may not always suppress ovulation completely, but they still thicken cervical mucus and thin the uterine lining, creating a less hospitable environment for both sperm and a potential embryo. Because hormonal birth control alters the natural ebb and flow of reproductive hormones, it can have a range of effects on hormonal balance. For many people, these effects are beneficial. For example, hormonal birth control is often prescribed to regulate irregular periods, reduce menstrual cramps, and manage symptoms of conditions like polycystic ovary syndrome, PCOS, or endometriosis. By providing a predictable supply of hormones, birth control can smooth out hormonal fluctuations that might otherwise cause discomfort or health issues. However, not all effects are positive, and the impact of birth control on hormonal balance can vary greatly from person to person. Some users may experience side effects such as mood changes, weight gain, headaches, nausea, or changes in libido. These effects are thought to be related to how synthetic hormones interact with the body's own endocrine system, which governs not just reproductive hormones, but also those involved in mood, appetite, and energy. One notable aspect of hormonal birth control is its effect on menstrual bleeding patterns. Many users experience lighter, more predictable periods, or even stop having periods altogether, especially with continuous use methods. This is due to the thinning of the uterine lining and the steady hormone levels preventing the buildup that would otherwise occur in a natural cycle. While this is harmless for most people, some may find the absence of a period disconcerting. Hormonal contraceptives can also affect other hormones in the body. For example, they can raise levels of sex hormone-binding globulin, SHBG, a protein that binds to sex hormones like testosterone and reduces their availability. This can be beneficial for individuals with conditions like acne or hirsutism, which are aggravated by high levels of free testosterone. However, in some cases, this reduction in free testosterone can contribute to decreased libido or other unwanted effects. Additionally, hormonal birth control can influence the body's stress hormones, such as cortisol. Some studies suggest that birth control users may have altered cortisol responses, which could affect how the body handles stress. The clinical significance of these changes is still not fully understood, but it highlights the interconnectedness of the body's hormone systems. Another important consideration is the impact of birth control on nutrient metabolism. Certain forms of hormonal contraception can affect the absorption and utilization of vitamins and minerals, such as folic acid, vitamin B6, and magnesium. While these effects are generally mild and easily managed with a balanced diet, it's something to keep in mind, especially for those with existing nutrient deficiencies. It's also worth noting that when someone stops taking hormonal birth control, it can take some time for the body's natural hormonal rhythms to reestablish themselves. Some people experience a quick return to normal cycles, while others may have delayed ovulation or irregular periods for a few months. This temporary post-pill adjustment period is a reflection of the body's need to recalibrate its own hormone production after being on a regulated synthetic regimen. The effects of hormonal birth control on mood are an area of ongoing research and debate. Some users report improved mood stability, while others experience mood swings, anxiety, or depression. The reasons for these differing experiences are complex and likely involve a combination of individual hormone sensitivity, genetics, and environmental factors. For people with a history of mood disorders, it's especially important to discuss these considerations with a healthcare provider before starting hormonal contraception. Hormonal birth control has also been associated with a reduced risk of certain cancers, such as ovarian and endometrial cancer, likely due to the suppression of ovulation and stabilization of the uterine lining. On the other hand, some studies have found a slightly increased risk of breast and cervical cancer with long-term use, though this risk tends to diminish after discontinuation of the contraceptive. Beyond reproductive health, hormonal birth control can have systemic effects. For example, it can impact blood clotting factors, leading to a slightly increased risk of blood clots, especially in individuals with predisposing factors like smoking or certain genetic mutations. This risk is higher with combination estrogen-progestin methods than with progestin-only forms. For individuals with polycystic ovary syndrome, PCOS, hormonal birth control is often used to help regulate cycles and control symptoms like acne and excess hair growth. By suppressing the body's own hormone fluctuations and reducing androgen, male hormone activity, birth control can offer significant relief. However, it does not cure the underlying hormonal imbalance of the PCOS, and symptoms may return if the medication is stopped. Similarly, those with endometriosis often find relief from pain and heavy bleeding with birth control, as the steady hormone levels prevent the monthly hormonal surges that fuel the growth of endometrial tissue outside the uterus. In summary, hormonal birth control exerts its effects by providing consistent levels of synthetic hormones, which override the body's natural hormonal fluctuations. This prevents ovulation, alters the endometrial lining, and thickens cervical mucus, all of which contribute to preventing pregnancy. Along the way, these changes can have a variety of effects on the body's overall hormonal balance, some beneficial and some potentially problematic, depending on the individual. Anyone considering hormonal birth control should have an open discussion with their healthcare provider about their personal and family medical history, lifestyle, and any concerns about hormonal balance or side effects. It's important to remember that there are many different types and formulations of birth control, and what works for one person may not work for another. Sometimes it takes some trial and error to find the method that offers the best balance of benefits and minimal side effects. Ultimately, hormonal birth control offers a powerful tool for managing reproductive health and family planning. By understanding how it affects hormonal balance, individuals can make informed choices and be proactive in monitoring their health and well-being. As research continues, our understanding of the nuanced effects of birth control on hormonal balance will only deepen, allowing for even more personalized and effective approaches in the future.